Everybody ready? Okay, I will remind the commissioners to unmute yourself, state your name when you're speaking. And again, for voting today on any measure or action, commissioners will be using the voting touchscreen. Good afternoon, everyone. I would like to call to order the March 19th, 2024 Senior Citizen Commission meeting at 2 p.m. Have we got roll call?
Let the record show that all commissioners are present.
Okay, I will lead us in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, that brings us to agenda item 4. I would like to introduce Paul Redfern. He is an Encinitas resident and the Chief Financial Officer of 211 San Diego. Thank you for being here.
Thanks for having me. I will be talking about a local service that we have here called 211. It's a 3-digit dialing code. I want to walk through basic services that 211 provides during normal day-to-day activities, and then disaster services. And then I want to go in specifically in how we address needs of seniors in our community. And then finally, some of the technological advancements and changes that we're seeing in the space. If at any time you guys have any questions or comments, concerns, please feel free to interrupt me. Hopefully we can make this interactive, and I won't add to the length of the meeting too terribly much. Next slide, please. So at 211, our core mission is to connect people that are in need to the very many resources that are in our community. As we'll see in a couple slides, there's over 6,000 or about 6,000 resources that exist either from nonprofit organizations within San Diego County or from government services. A lot of times when people are in need, they don't know where to turn. It's not like calling 411 for those of us that experienced that back 20, 30 years ago, where you called and you asked for a specific number or a specific business. When people are in need, frequently they're calling because they say, I don't have food, or I don't have transportation to a medical appointment, or I don't have refrigeration for my prescription medicine. And so 211 bridges that gap and that divide by connecting people to the specific resource that would be appropriate to them. And I'll walk us through a little bit of how we do that. Unfortunately, another part of our mission is to identify where there's barriers or there's gaps to these resources. See, 211, we're really only as good as the resources that do exist in our community. And if you've driven around town, Encinitas, other places in San Diego County, we know that there are a lot of needs that are not being addressed on a daily basis. Even driving here, exiting Interstate 5, there was a need that was not being met for a person that was standing on the corner. And so we work with our communities to say, how can we provide more resources? What are the tools that we're going to need to bring into our community to make sure that those individuals that are not being served could be served in the future? One of the ways that we do that is through grant applications. We have a very robust business partnership development team that reaches out not only to people within San Diego to try to find new grants and contracts to bring resources to the community, but to Sacramento and to Washington, D.C. and other places to say, we know that there are barriers here and we want to overcome them, and we'll touch on a little bit of those. But ultimately, our goal or our vision is that all people have equitable access to the resources in our community. We are a 24/7 phone line. At any moment, anytime, you can dial the 211 dialing code and you will be connected to our nonprofit here in San Diego. We do information and referral across about 14 different domains. And so of the 6,000 resources that exist in the community, we do compartmentalize those into 14 domains, be it food, be it housing, be it senior services, legal aid, hygiene, things of that nature, and we'll get into that. Another area that makes us somewhat unique is that we are able to do things telephonically that other organizations across the state have not been able to do. And this was huge during COVID. As we saw, social distancing, businesses being closed, nonprofits were closing as well. Their doors were closed. They were not able to do social care. They were not able to do case management with their clients. We were able to transition that with our nonprofit partners and some of the local governments to telephonic work. I'm sure that we all got really used to using Zoom and Teams and other FaceTime applications. And so 211 was able to use our technology that we had to leverage that during COVID. And a lot of that still remains. Telemedicine, right? There was a resistance to telemedicine on the healthcare side that in a large part is gone now because we're so used to different ways of interacting and doing business. And 211 is certainly at the forefront of that. And one of those is with application assistance. And we'll touch on food insecurity and how that impacts seniors here in a couple slides. But we do help people complete their CalFresh applications over the phone so that they can get that food assistance. Right now, we're in tax season. We are the prime contractor in San Diego County to get the VITA appointments, so the free tax preparation assistance. We set those appointments and we deliver or direct people to the various locations where they can get that done. And then a large one for our senior population is certainly we have contracts with FACT and with Lyft, which are two ride providers. And so if there's transportation issues or barriers, we can help them overcome that in some certain situations. We also have moved on to different types of application, including Medi-Cal and Medicare. And so, we pioneered the telephonic signature for applications in San Diego County and the state of California about 15 years ago. And now we've expanded that into some of the other programs that are available. So overall, we're here to provide support 24/7, for all sorts of social needs in our community. And, certainly seniors are a big population that we serve. Next slide, please. One area where we do get a lot of press that we're introduced to people in the community that otherwise probably hadn't heard of 211 or used 211 is during disaster. And so we are activated by the Office of Emergency Service or CAL FIRE, or in case of widespread disease by Health and Human Services in the County of San Diego. And we respond to non-emergency calls that are not appropriate for 911. Those are deployed to 211. And so wildfire season, if there's a wildfire, if there's a public safety power shutoff where SDG&E depowers some of the lines because of high winds and possible fire threats, those calls get directed to 211 for help with family reunification, large animal evacuation, other resources that might be available. With the flooding that I know happened up in my neck of the woods close to Leucadia and certainly down in the south part of the county, 211 was deployed by the Office of Emergency Services for about 4 weeks to help address people that were displaced or had property damage due to that flooding. We also staffed the local assistance centers that were set up both by the county and by the city of San Diego. And so we do play a pretty extensive role during times of disaster to decompress that 911 line. You guys may recall the Lilac Fire in 2017. We were activated for that. Calls to the 911 system were answered in 30 seconds, and we were answering hundreds of calls every hour. So we were able to decompress that. There was a young man, adolescent, that was in a trailer that burned, and he woke up. It was on fire. He called 911. They were able to address him, get him out. But because we're taking calls about, hey, I smell smoke, what should I do? Am I in an evacuation zone? We're able to decompress that 911 line, which is helpful to the community. Also allows us to collect information around rumors and trends. And so we also provide that service back to the official command post during disaster. Here's a list of some of the disasters that we've responded to. Next slide, please. So you can see going back to the 2007 firestorm, that was our first big event. At the time, we were about $1 million organization per year with about 20 staff. Now we're over $28 million a year with over 300 staff. So those were very early days, primarily staffed with volunteers. We've responded to other communities' disasters. We've taken calls from Houston during Hurricane Ike, for example. But we have, various fires, but also you can see up there some of the public health emergencies like hepatitis A and, of course, COVID-19. So next slide, please. So that's, the disaster side of things. Some of our specialty lines, and I think this is where we see a trend within 211 going, having those collaborative partnerships where we know that telephonic or text interactions could be done to enhance the quality of life for certain populations. And this is an area where we've had a lot of success in partnerships, both with governments, but also with nonprofit foundations that have funded us. CalAIM is our opportunity to work directly with healthcare providers on the social determinants of health. Social determinants of health is a huge movement in the health circles, trying to address the needs that go beyond prescription medicine or medical addressed services. So medically prepared meals, the rides that I spoke about earlier, making sure that there is that refrigeration for prescriptions, social interactions can be a prescription, right? And so working with the healthcare providers here in San Diego County to make sure that those that have health issues, that those health issues are also being addressed on the social side. So making sure that the care that they receive is as effective as possible. We staff a Section 8 line for the housing subsidies. I will say this is an area where, as we talk about, we're only as good as the resources in our communities. We answer the lines and we're able to provide information, but the waits are extremely long. So somebody that applies for Section 8 housing, it can still take years to get to the front of that line. And so those are very challenging calls to take when you're dealing with somebody that maybe applied 12, 24 months ago, and they're still trying to get that housing subsidy or try to get into that Section 8 housing, and they're unable to for another year. Those are some of the calls that we take. We do work directly with veterans in our Courage to Call line. We have specific peer-trained specialists that deal with not only the various resources that are available to all of us in the community, but specifically to veterans, active military, and their families here in the community. We work with the younger population with our First Five program, which comes from the tobacco tax. It was implemented decades ago at this point, but from pregnancy through age 5, making sure that the health needs of children and their families are being addressed. And then CalFresh, which is our food supplemental nutrition assistance program in California. CalFresh is what it's called. We help with those applications. Number of other things. We actually do answer other lines other than 211 at this point as well. So we do answer some of the calls that go to the County of San Diego in their access line, which is a line specifically around public benefits and getting information about where those benefits are. Next slide, please. So older adults specifically, if we can get to a little bit of where we are getting calls specifically from the senior populations. I think in San Diego, there are myriad needs. And I think that we frequently point out food because there are a number of food resources. And so fairly regularly, be it a senior or be it somebody that's not a senior yet, we do get calls and they're asking about rental assistance or they're asking about utility assistance. Sometimes those resources aren't as readily available as food, and so what ends up happening is that the phone call or the conversation starts to shift to where can we provide assistance? And certainly one of those areas is through food. So we have food resources in our community, even in Encinitas, on an emergency basis right across the street at the Community Resource Center at 2nd Street. You can get food resources there. Longer term, we can assist you with the CalFresh application. You can go to the Coastal Roots Farm and you can get vegetables, there as well. So, there are a number of those. My kids, I've got a senior at San Diego Academy. I've got elementary school kids at Paul Leckie. There's food and meal programs available to them as well. And so there is a number of food resources. And so a lot of the calls end up going that direction, even if that's not the stated need of the callers all the time. That's an area where maybe we could defray some expenses and free up some dollars for some other areas for people that may be on fixed income. For seniors specifically, we do have the Meals on Wheels meal delivery program. We are also working with our hospitals on discharge for the Healthy Meals program as well. And so we are specifically able to provide connections to those resources for seniors. Healthcare coverage, as I mentioned, we are able to do Medi-Cal, Medicaid applications over the phone. And I've been successful in doing those telephonically for people that are either underinsured or uninsured. And then we can do that assistance telephonically. So for people that have transportation challenges, we're able to do that that way. And then, as we mentioned, we do have the VITA appointments for the tax preparation that's been going on. During various times during the year, we do get activated for cool zones. So we get a number of people that, maybe not in Encinitas, but in other parts of the community that are looking for a place to get out of the heat. And libraries are a big one, public buildings, things of that nature. And so we're activated for that. We can also provide help with transportation there. Legal aid is a big one. As we've kind of gone through a tumultuous 3-4 year period, there have been some changing rules and regulations around housing and rentals and things of that nature. And so we do connect a number of people of all ages, but certainly seniors to those legal aids. But we do have a long list here, and we're happy to share the slide deck with you guys. So one of the ways that we see a change in the landscape is how we connect people to services. 211's been in San Diego County for just under 20 years. As I mentioned, we have grown tremendously, but 20 years ago, 15 years ago, even 10 years ago, the norm was anonymous phone calls. We want confidentiality. We don't want people knowing other people's businesses. The challenge that we had with that was twofold. One, I could talk to somebody last week, and they might call and say that they have a legal aid issue, and we might be able to help them with a resource. They could call back next week and say, hey, I'd like to speak to the person I spoke to last time. And we'd have no record of that call. And so that was one shortcoming that we saw on the anonymous phone call. The other one, which is more pronounced, is we discovered that when we provided somebody a resource and said, hey, here's the 10-digit phone number for community resource or Coastal Roots Farm or to one of the other resources that's in your community, people didn't call. There was over 50% of the time that person did not get the help that they were asking for. We don't know if that was because there was an emotional drain. I've just told this story to you. Now I'm going to have to call somebody else and tell them this story. But it was very challenging. It was a shortcoming in our services. And so in San Diego County, we pioneered the Community Information Exchange, which connects the largest nonprofit organizations in our community with one client record. And so if you call 211 San Diego and you have a need, in most cases now, we can connect you directly to the resource that we're giving you over the phone. We can send you a text message with that specific information. We can also let that other nonprofit organization know that you will be coming to come see them. So they will know to follow up. And so that has not only increased our ability to connect people successfully to resources, but it's also helped inform the organizations that are providing that care. If you were to call 211 a week later, based on your phone number and some authentication that we could do, we could pull up your record and we could say, hey, I saw that we were able to refer you successfully to Community Resource Center. It looks like you were there. Yeah, that was great. Let's address the next need. And so we have this longitudinal record that has been created in the Community Information Exchange with individuals' consent and authorization that allows not only 211 to better understand what the client's journey has been from safety to stability to self-sufficiency, but also a shared record with other nonprofits that might be serving that client. In some cases, we're also able to give alert notifications to care team. So let's say, for example, I become a client at the Community Resource Center, I'm getting job counseling from them. They can become part of my care team. If something were to happen, like I was admitted to an emergency room or if I was detained at a jail, they could get an alert notification that something has changed in my status, and so that now they can do proactive outreach. And that's one way that we're bringing the services, the casework, the nonprofit organizations around those people in need by creating this longitudinal record through integrated technology, but also shared language and shared understanding. And so our Community Information Exchange team meets with the network partners on a monthly basis, if not more. There are breakouts of smaller concern hubs which focus on specific populations that are being served as well. Next slide. And so here are some of our numbers. I don't want to bore you with it, but we do have over 1,200 nonprofit organizations in our database. It says 5,600. It's closer to 6,000 at this point of services. This 337,320 consented clients, those are clients that have called 211 or visited a nonprofit partner that have consented into our Community Information Exchange. So about 10% of the population of San Diego County is consented into our Community Information Exchange for that longitudinal record. 135 partners in CIE, it's up to about 148 as of today, and multiple users that are using it on a monthly basis. And so We are doing the direct referrals. We're working together with our community to make sure that people have that equitable access to the resources that are available. But we're also working very closely with our county government, with our cities, with our municipalities, and our partners to find areas where there are barriers or there are a lack of resources in some case. So 211 is here, certainly for the city of Encinitas and its residents. We could always use help. One of the areas that we could use to help the most is as you interact with different nonprofit organizations on a regular basis, if you would, please remind them to make sure that their information is up to date in that 211 resource database, which is publicly available on our website at 211sandiego.org. Obviously, it's the same resource database that we use when we talk to clients over the phone. But as various nonprofits crop up, or as churches do food distribution, or they do backpack drives, those are great things for us to have in our resource database so that we can get the word out to make sure people are being connected to those resources in our community. I think that's it. Yeah, thank you. So we did have to do a plug for specific data reporting because of the volume of information that we get both over the phone and through the resources that we're connected to. We do have robust reporting opportunities. So if there are specific things that we can provide around certain demographics, callers from the 92024 area zip code, happy to provide that as well. But we do have informaticists on staff that can provide specific reports. I think that's it. There we go.
Thank you, Paul. Commissioners, do we have questions for our speaker?
This is Commissioner Angel. Thank you so much, Paul, for this very insightful overview. I do want to let you know that I have personally utilized 211, and I am a veteran service officer, so I work regularly with veterans, and I have also referred veterans not only to Courage to Call, but to 211 in general. So thank you so much. It's a wonderful resource.
Thank you.
This is Commissioner Hanwitt. The amount of resources you have is just amazing. I wanted to just ask you a specific question. Like, for instance, if I were to call 211 because I needed a ramp to get into my house, I have steps, I can't get up the steps, what would the answer be? And I live in Encinitas, but I don't qualify for county resources. My income is too high for that, so I'm not, I couldn't qualify for help, monetary help in that way. What would the 211 person tell me?
So the 211 agent would take a caller through the specific resources that are available for everybody, and then there would be a screening process. And so that's one thing that we want to make absolutely certain of, is that if somebody's calling us, we want to make sure that they fit the profile. For example, I talked about the First 5 program for women that are pregnant, all the way for children up to 5 years of age. If you're calling in and your child's 7, that doesn't mean that we don't care and that we don't want to connect to resources, but that First 5 program is not for that specific area. And so there are a number of resources that we have in our database that are specific for household size and income of the household. And so in some cases, the answer is we don't have a resource in our community that addresses that specific need, but we will work to try to find other things. I think that what we are going to see as far as further iterations is a little bit more collaboration with for-profit resources. We don't really have for-profit resources in our database. A very few, like if there's lawyers that work around specific cases, for specific demographics, there's ways for them to get in the resource database. But I do think that we are on a move now to where we understand that there are people that have legitimate needs, and sometimes the nonprofit resource isn't the right resource specifically in that case.
Okay, thank you.
Commissioner Copeland, simply thank you. I have availed not only myself but clients to 211, and what I find compelling is that in this myriad of waiting on phones, you can actually have the opportunity where they will call you back, and they do. So again, thank you so much. Definitely a resource that the county's done very well with. Thank you, Paul.
Thank you.
Commissioner Martin, thank you. It was great. I have a couple of quick questions. In an earthquake, I was in San Francisco earthquake, almost everything went down. Do you have like backup generators that support all of this?
We do have a very large backup generator that can power about twice our building size. But we are also on a very large phone system, which can be ported other places. So I mentioned that we helped Houston and a few other areas when they went through disasters. If we were in a situation where we couldn't bring staff to the office safely, then we would likely port that out to another 211 someplace else.
Yeah, that makes sense. And the other thing is you talked about all your numbers as far as all the calls coming in. Are you doing anything on the exit in the sense of a survey or text to people that have been served? How did it go? Is there anything you would recommend?
Absolutely. We do offer the option for a survey for up to 10 days after resources provided to a caller. So that's an opt-in model on the phones. But what we found been very successful for the closed loop information is that community information exchange. So when we have the 330,000 plus residents of San Diego County that have opted in and authorized us to keep a community information exchange record, if we refer them to a specific place, well, then we'll continue to get updates on what their progress is.
Right. Thank you, son.
Thank you.
Commissioner Ling here. Thank you again for the presentation. I do have a couple of questions. I feel like I'm in the minority here in that I was not aware until you presented this today about just how many resources and services are covered by 211. So my first question is, what do you do for outreach? How do you make more people aware of the services that are provided by 211?
We do have, obviously, social media presence. We do certain campaigns based on funding that we receive. I mentioned a public safety power shutoff, which is big, especially in the east counties where the winds can get high and SDG&E will depower. They'll advertise on our behalf to tell people to dial 211. During disasters, the wireless emergency alerts, the WIA, as we call them, those have been utilized to refer people to call to 211. But if you call 211 around lunchtime on a Monday, especially the first Monday of the month, you likely will opt into the callback option because we have extreme call volumes on the first Monday and Tuesday of every month. It seems like that's the time that people tend to call us. And so, candidly, we get into a little bit of a challenging situation where we could do advertising campaigns. During the flooding, January 20th, 22nd, and beyond, news stations would say, call 211. People would call 211. It didn't mean that we had more resources available to us. And so what we find is there's probably about a third of the population that understands and knows about 211, and they regularly call us. Plus, we do get a lot of referrals from other nonprofit agencies. So, for example, I was on the YMCA board here in Encinitas, and the Y has a number of resources beyond youth sports and pool facilities and weight workouts, but they don't have every resource. And so, sometimes they would come across a member or a staff person that, might be housing unstable, and they would refer to 211. And so we do get the word of mouth. It's probably one of the primary ways that we get referred.
Okay, and my next question, my last question, is I was actually, I had heard about this particular situation. It was in our community and senior center in Encinitas, and it occurs to me that this is something where 211 might have been helpful. It was a senior, came in asking for legal assistance, and I think seniors will do that. They'll say, oh, we have a senior center, maybe they can help me. She had no phone number, no contact information. She was asking for legal aid. I think the front desk tried to call some of the numbers that they knew, but I'm pretty sure they did not know about 211. So is there something you can do for, in terms of having senior centers aware of that as a resource and being able to refer a senior to that?
Absolutely. And, our resource database, we work with different organizations, including senior centers throughout the county to make sure that we have the appropriate hours of operations in our resource database. So we can certainly, and I will take that as a note to take back to our resource team to make sure that not only are we having up-to-date information for their services, but also, sending back the request to make sure that the staff is aware of what 211 does. So I think that, it's a great point that if we don't have a resource available from where we're sitting, that probably the next call that's most appropriate is to 211, and we can definitely search through the various resources in the community.
Okay, thank you.
Yeah.
Any other questions? All right, thank you, Paul.
Thank you all.
Okay, that brings us to agenda item 5, oral communications. Do we have any oral communications speakers today?
There are no oral communication speakers today.
All right, next item on the agenda, changes to the agenda. Do we have any changes to the agenda?
Yes, please note a correction to Agenda Item 8A under the analysis section to change the name of Vice Chair Angel to Vice Chair Hanwit.
Okay, duly noted. Agenda item 7, approval of the minutes. Do I hear a motion to approve the February 20th, 2024 meeting minutes?
This is Commissioner Hanwit. I make a motion to approve the February 20th, 2024 regular meeting minutes.
Okay, Commissioner Hanwit makes the motion. Do I hear a second?
This is Commissioner Martin. I second that motion to approve.
Commissioner Martin seconds. We'll do touchscreen voting to approve the minutes.
Commissioner Angel, my screen is not allowing me to vote, so it's still stuck on signing in.
Yeah, you have to sign in.
Stuck, I tried several times.
Is it possible to get some IT assistance, please? Thank you.
I can do it on the next computer, I suppose.
Okay. Okay, motion passed.
So let the record show that the motion to approve the February 20th, 2024 regular meeting minutes passes unanimously.
Thank you. Agenda item 8. So we are at the beginning of a new fiscal year term. So one of the things we get to do every year, agenda item 8A, is to select a chair and a vice chair to run the meetings for this next year. Do I have any nominations for the chair?
This is Commissioner Angel, and I would like to nominate Commissioner Ling for the chair position.
Okay, I accept the nomination. Are there any other nominations?
This is Commissioner Martin, and I would like to nominate Jesse Hanwick, Commissioner Hanwick, for vice chair.
Okay, but no other nominations for chair?
Oh, sorry.
Okay, that's all right. Gone? Okay.
Did we get a second for that nomination?
Do I hear a second for the nomination for?
This is Commissioner Hanwit. I second the motion for Commissioner Ling to be the chair.
Okay, and I accept again.
Congratulations, Commissioner Ling, on your position as chair.
Thank you. Now let's proceed with nominations for vice chair.
This is Commissioner Martin, and I would like to nominate Commissioner Hanwick for vice chair.
This is Commissioner Angel. I would like to second the nomination for Commissioner Hanwood as vice chair.
This is Commissioner Hanwit. I accept the nomination.
Are there any other nominations for vice chair? No.
Well, congratulations, Commissioner Hanwit, on your position as vice chair.
All right, that brings us to agenda item 8B. So there's two parts to this. One is to approve the summary of outcomes for the previous work plan for 2023 to 24. And then the next part, which is probably the longer part, is going to be for us to start putting together the work plan for 2024-25. So do I hear a motion to approve the fiscal year 2023-2024 work plan outcomes, or do we have changes we'd like to make?
This is Commissioner Hanwett. I would like to make a motion to approve the fiscal year 2023-2024 work plan outcomes.
Commissioner Hanwood has made the motion to approve. Do I hear a second?
This is Commissioner Martin. I would like to second the motion to approve the work plan summary.
Okay, we get to vote on that. Commissioner Martin is seconded. Do you have to go one over again?
Let the record show that the motion to approve the Senior Citizen Commission Annual Work Plan for fiscal year 23-24 is approved unanimously.
Okay, this is the hard part. Let's have a roundtable discussion to prepare the fiscal year 2024-25 work plan. So the way I'd like to proceed with this is everyone should have a copy, a fresh copy of the new work plan. Nothing is filled in yet. Everything is subject to change. But I would like to first look at what things we want to keep. This is based on last year's work plan, so there may be things that we don't want to change. What things to keep, what things we can discard at this point. And then once we do that part, we can also look at some of the work plan items that we may want to tweak a little bit. And then last but not least, we can have a discussion about what things we would like to add. Now, I wanted to point out that there are 5 commissioners here, but we should approach the work plan as though we are fully staffed, that we have all 7 commissioners, because there is still opportunity for some to come in. And at the very end of this, we will also see if there's which of the commissioners are interested in the various ad hoc commissions, groups. Okay, so what should we keep?
This is Commissioner Angel, and I make a motion that we keep work plan item number 4.
Okay, so no need to make motions. This is just a discussion. Let's start with, do we have any objections to keeping work plan items 1 through 3? These are the ones that all members are involved in?
Yeah, this is Commissioner Hanwood. I do not have any objections to keeping 1 through 4.
Okay.
This is
So-
Commissioner Angel. I support that.
And then, okay, and 4 is the partnership for the Rotary, with the Rotary Club and other organizations for the senior awards.
So Commissioner Koblenz, for clarification, keeping 1, 3, and 4?
1, 2, 3, and 4.
1, 2, 3, and 4?
Yep.
No, sorry. Keeping but not modifying, right?
We can still modify later if we want to.
Okay, keep it, but we can modify it later.
Sure.
Okay.
This is Commissioner Martin. Can I
Sure.
put my 2 cents in?
Sure.
There seems to be an overlap between 1 and 3. I mean, all of the things that are in 3 with the community center are really actually officially in 1.
I actually do not agree,
Yeah.
because 3 specifically addresses volunteerism. And through volunteerism, we find out what programs we can be involved in and how the programs are doing.
But, excuse me, 1 actually in outcomes says very clearly volunteerism.
For city-sponsored and city-partnered events.
But it's events.
City-sponsored. That's the key.
Oh, okay.
This is Manager Goodsell. Would you want to add the word city-sponsored or city events and programs to number 1?
We can.
Would that make sense? And still keep 3, but remove community and senior center, and that would be moved to number 1 because it is a city facility?
Okay, let's table that for now, but that's a possible change that we can make. So at the moment, we're keeping 1 through 4, possibly rolling 3 into 1.
I was suggesting just rolling a portion of
Portion of
three
it?
into one.
Okay.
Because the community and senior center is a city facility. So any programs
Okay.
out of the community and senior center would fall into goal number one, I would think.
Okay. Is that the intent, Commissioner Martin, what you were,
Yes, that's what I was saying.
okay. So we'd keep all three, but change the context a little bit for one.
This is Commissioner Angel. Point for clarification. Might we get an example then of what that is not city-sponsored would fall under volunteering in item number 3? So
So,
I'm asking for an example of what might fall in item number 3.
and I'll see if I can clarify. So I think activities that are put on in the community and senior center would roll into 1, because that's part of City of Encinitas. So what remains is local community service organizations. So for example, Community Resource Center, volunteerism at the library, that kind of thing. Does that sound about right? Okay, so community and senior center volunteering would roll into work plan item 1.
This is Commissioner Angel again. I just want to make sure I clearly understand. For example, previously I volunteered to help with art night. Might that be an example of item number 3?
That would be an example, this is Manager Good, so that would be an example of number 1.
Number 1,
Since it is a city event.
Okay. Okay. So volunteering at the library would be an example of item number 3, although that's a city.
Correct.
Okay.
Or, for example, the volunteering at the Community Resource Center, or another nonprofit. Chamber of Commerce would be another example.
Or would you like it all rolled into one? So it's volunteering at community events and city-sponsored and partnered events.
That's okay, too? Do we want to
Yeah.
just roll that into,
I think that
roll
sounds
everything
good.
into?
This is Commissioner Martin. That was kind of my thing because it wasn't very clear to me when it talked about the community events and then community center. So I,
Okay, that's fine. So let's do that.
This is Manager Goodsell. So I can identify who you're volunteering for, which organization, when I list it in the outcomes.
that would be very helpful. Thank you.
Okay. So we are going to strike out work plan item 3, roll all of that stuff into work plan item 1. Okay, back to business here. Work plan item 4, we keep. Work plan item 5 is intergenerational programming.
I would, this is Commissioner Angel, I would like to see that kept as well.
Okay.
The intergenerational.
Everybody agree?
Yes.
Yeah?
Are-
Did you have a comment, Commissioner Koblenz?
I just want to clarify, we're speaking about, I'm keeping item number 5.
Yeah.
Absolutely.
Okay. The next item is create and sustain ongoing programs for adults 50 plus.
Can we move this up?
Oh, there we go. And yes, let's take out Feeling Fit Club. That seems to be a sore point, so we're going to strike that out. But everything else, do we want to keep that one?
Commissioner Koblenz, item number 6 is pretty wordy. I'm wondering if we take out Feeling Fit and classes offering at
Want to think about it?
yeah, thank you.
Yeah. So,
This is Manager Goodsell. A suggestion might be create and sustain ongoing programs for adults 50 plus at the Encinitas Community and Senior Center, Encinitas Parks, and/or San Diego County Libraries.
And we don't have to
Encinitas.
itemize the list. I'm okay with that.
I'm okay with that.
So the outcomes can be more of an itemized, what programs we're supporting. Everybody okay with that? Nice. Okay, work plan item 7, leverage participation in Age Well San Diego 2.0.
This is Commissioner Hanwett, and I personally would like to see that stay in because I think it's important that we know what's happening on a grander scale. But I would, because I'm ever hopeful, like to add that we also leverage participation in Encinitas, the city of Encinitas' participation in the age-friendly cities, which hopefully will happen.
Do we want to put those together then?
I think
Do we
they
want to
could
say
go
Age Well
together.
San Diego and age-friendly, the AARP, age-friendly
Cities.
cities? Put
Point of
that together.
Clarification, Commissioner Koblenz. Commissioner Hamwick, do you have an example?
Well, we sent the letter to the city
Right.
council, and we're kind of on the brink of going forward with that. Finding the right contact person to approach it at the city level. And it's my hope that they're going to say, yeah, let's look into it further. And I think we can be a big part of that because it's not necessarily the over 55 population, it's all ages, but I think we would have a lot to offer as far as suggestions on how the city should go about doing that.
And just for context, Age Well San Diego is a countywide program.
Well, Age Well San Diego is adopted by the county, has been adopted by the county and neighboring cities, and Vista and Oceanside and many others. Whoops. So we would be looking to have the city of Encinitas join that.
Oh, you're thinking about age-friendly.
Yeah, age-friendly. Yeah, Age Well is county.
Age Well is county.
Right.
Age-friendly is AARP at a national level, actually, but several localities within San Diego County have already adopted, including the County of San Diego.
Help me understand, are you asking then that we add to this work plan item the age-friendly?
Yes.
Yes.
Yes, because assuming this goes forward, there will be a work plan that the city will develop, and it will include things like housing and transportation that I feel that we would have an input, a good input, a
Yeah.
valuable input.
This is Manager Goodsall. I don't know that we can necessarily assume that the city will be moving forward with
No, we
that,
can't.
giving approval within this work plan timeframe. I can't guarantee that. So would it be better to word it as researching or attending meetings or gathering information?
Yeah.
Because we are not currently part of that program.
Right, no, that would be great.
Okay.
Just so that we have the opportunity to participate in whatever way is appropriate, and that we can come back and share the information that we found.
So maybe exploration of opportunities?
Something. Yeah, so
And
Age
I'll let you
Well 2.0
wordsmith
is in.
Yeah.
Age Well, age-friendly communities, age-friendly cities is something that's sort of up for discussion.
Continue to explore.
Yeah, that's fine. We good with that? Okay, I think work plan item 8 is also still essential. We still need to have a grant writing ad hoc to support some of these other groups. Any objections? Work plan item 9. We want to turn this into something else. This is the survey for adults 50 plus.
We do want to turn it into something else, but I think we need to mark that complete
Okay,
as a completed item.
okay. Noted. And last but not least, work plan item 10, research best practices, send letters of support.
This is Commissioner Hanwood. I wondered whether it would be appropriate to add to that. I mean, we've sent in, since I've been on the commission, we've sent in 4 letters, and we don't receive feedback unless we happen to bump into somebody or in a class or something, we can ask about it. But would it be appropriate to add to the work plan that, like, and follow up for further information after the letters have been received?
Okay, sure. I think that's appropriate. Okay,
This is Commissioner Martin. Follow-up is in there. Under outcomes, the last 4 letters, four words.
that's true.
And send letter
So the intent is there.
submitted to city council and commissions. Where's follow-up? Oh, on the right. Oh, it does say in file, but maybe we can put that on the left column. Follow-up.
Yeah, and then itemize outcomes related to that. I'm okay with that.
I don't pay
Okay.
attention to that.
So it looks like we're merging work plan item 3 into 1. We are going to find a replacement for work plan item 9, which was the survey. And everything else we are keeping and maybe tweaking. Does that sound about right?
And this is Manager Goodsell again. There's no need to replace number 9 if you feel like this is a robust work plan and you have enough to work on.
So
But
I
you
think-
are
I think-
able to, as you see fit, if you'd like to add an additional work plan
Yeah,
item.
and
it's
I'm
not
pretty sure
required.
Commissioner Koblenz has something in mind. But we are closing out the survey and the results of the survey. And Commissioner Koblenz, would you like to propose something to add?
Yes, and Commissioner Koblenz, our speaker was a perfect example today, and thank you, Commissioner Ling, about the actual promotion of some of the resources that we have. And I think there's a way that we can be better at resources that are readily available for our senior community.
Okay.
And I think, as Commissioner Angel mentioned, she's had the opportunity to work with it. And I think there are several, and I think that's part of exactly what we're attempting to do, is to not recreate the wheel, but find resources that are approved, that our seniors have readily available so that they can take their next step. So,
And promote them. Make people aware of them, I think.
yeah.
And this has actually been a recurring theme for the last few years.
Oh,
We've
yeah, I
talked
know.
about
Yeah.
outreach
Mhm.
and promotion.
Yeah.
But I think it would be good to have a work plan item that specifically talks about outreach and promotion of programs that help adults 50 plus.
And thank you, that's exactly next, and promotion of those. And I'm suggesting that I did, based on so many things, I will be attending the academy. And I think it's really important that we find a way to hear what other commissions are doing. As I'm going to some city council meetings and hearing other commissions, it appears to me that seniors are not mentioned specifically. Now, I don't know anything other than yes, we're the senior commission, but when I look at what we call unintentional consequences of decisions that are made, I think that's really, really important because it is going to affect us. I have a graph, but it's irrelevant. Even when this group is on to their next, we have the silver tsunami coming, and they're going to be seniors. So I'm kind of looking at how we're going to make sure that decisions that we make, I would at least like to have somebody come and say, what do you think? I know it's not feasible for me to go to every commission meeting, and I don't think it's feasible for any. I know we've talked about speaking as a private citizen, and that works too. But I think there's an undercurrent that we could do.
So let me suggest a description, and I think between now and next month's meeting, we can wordsmith it until
Okay.
we have something in a final draft. So what I was going to do was suggest that we basically, for work plan item 9, we talk about identifying and promoting programs that enrich the adult 50-plus community, and promote the needs of that community in various city organizations. And that includes, speaking at the councils, perhaps speaking as a community speaker at some of the commissions. It means finding other ways to get our point across, that they, to remind them that they're seniors that are important.
So I think that's good, and maybe if we use the word disseminate information, that keeps us from taking a side,
Okay.
and we're disseminating information.
Manager Goodsell, you have, you think you can capture all that?
This is Manager Good, so I'm glad this meeting is being recorded. But I am taking notes.
Well, and this is Commissioner Hanwett, and I've been thinking too that I wish there was a way that we could include Village Encinitas in maybe this particular item for dissemination might be a way that we can do it, because it is happening, and it's, pretty much poised to reach out into the city, and it would be a way
And that's,
to
again,
get
disseminating
out.
information,
Yeah.
and it's clear, we're not taking sides yet.
So I do feel that
Yeah.
would fit into this
Yeah.
particular work plan item.
Uh-huh.
I agree. I
Mrs.
think it
Manager
would be
Goodsell's-
great on the outcome, and we'd all talk prior, the aspect of how all of us are eager to hear updates, so it would put it as a regular
that would be
update
great.
in a way.
So I think, did you have a?
This is Manager Goodchild. We wouldn't be able to partner with them or form any kind of an MOU because they are membership-based, but it is a resource.
Right.
And it's important to be informed.
Exactly.
And to be able to disseminate information.
But they're 501(c), right?
Yes. Yep.
Perfect.
And we did have them speak
Right,
at the
yeah.
commission meeting a couple of times, so that's certainly okay, and we appreciate that.
But I think the whole idea here for work plan item 9 is to help people become aware of some of the services and programs that are offered for seniors in City of Encinitas. That's really the bottom line.
This is Commissioner Angel, not to belabor the point, but again, just a point of clarification. Manager Goodsell, when I heard you say we're not able to partner with them because this is a membership-based organization, help me better understand how that might differentiate from the Rotary that we've been partnering with for years, and they certainly are a membership-based organization.
You do make a good point there. So I think the way the city looks at it is, for example, there's the YMCA or 24-hour fitness. There's a membership fee in order to join. Is there a mandatory fee to join the Rotary, or can you participate without paying a mandatory membership fee?
I know.
I think you have to pay dues. I'm not sure. Commissioner Angel?
That's a very good question. I cannot answer that at this time, but it does seem to me, if in fact there is a requirement to pay any type of dues/membership, then that has set a precedent for this city. And I'm happy to contact the Rotary. I live
So
right
that's
next
something to
door
look
to the
into.
president. I will find out.
Good point.
For work plan item 9 then, I think we'll kind of keep that aspect of it open, but the whole idea is that we want to promote and provide information for programs and services that are offered to seniors in the City of Encinitas. Is that a fair summary, and we can get more specific about outcomes in a little
Yeah,
bit.
because I hear what Commissioner Angel is saying, and the truth is, Encinitas Chamber of Commerce also has annual dues, so they are a membership too.
Yeah.
Just an FYI.
Commissioner Martin, just a question. That due in your village, starter village, is that a suggested due, and even somebody who absolutely positively could never pay it would be excluded, even though they live in that neighborhood?
No, nobody would be excluded, and the membership dues, it's not designed to make a profit. It's just designed to cover operating expenses. So, they'll probably be $60 a year, $10 a month the most. So it's very minimal. But if somebody couldn't afford that, oh, no, of course, that would be.
Okay, so it's not mandatory.
It's
Suggested
not-
donation.
It's definitely suggested,
Yes.
but.
So rather than get bogged down on dues or not dues as a condition for partnering, let's move on. I think, do we want to get some outcomes filled in for this particular meeting?
This is Manager Goods. I just wanted to touch base again on number 6,
Yep.
which says create new and sustain ongoing programs for adults 50 plus, and then the new replacement for number 9, which is identify and promote programs that enrich adult 50 plus community.
Yes.
So one is the marketing side of it and promotion, and the other one is the development side of
Yes,
programs.
I think
Is
so.
that
So,
correct?
yeah, so creating programs within the context of the Community and Senior Center at Parks and Library.
Could we combine
Could we
those
combine-
two, or it's
I was just
creating and promoting the programs and resources?
I feel
Or
like
would
they
you
should be
rather
separate.
separate it?
I feel like they should be separate because the folks that we would interact with are kind of a different group. I feel like work plan item 6 is really working more with staff and looking for new programs to add to the community center, for example. So,
I disagree.
No?
I think the key here in item number 6 is sustaining. I think that's part of our biggest situation right now, is keeping who we have, what we have. I'm not even remotely opposed to new ones, but I think in order to be healthy and thriving, we need to keep what's working and build on it. So I think sustaining is really important in that one.
Yes.
And I don't know, but right now, based on the survey, it looks like we pretty much know what we need.
yeah. But we've also lost a few things.
Yeah.
Along the way. So one of the most common comments in the survey was, well, before 2020, we used to have this program, and we used to have this one. Can we have these back? So,
Well, and this is Commissioner Hanwood. The other thing, too, that I was thinking about is that we got a little bit of a head start on the possibility of having an intergenerational garden and working with the Boys and Girls Club. And our thought was to try to create a gardening class at the senior center, and the people that were participating in that be able to come and volunteer at the Boys and Girls Club. So that would be something new that,
No, I'm not opposed to adding new. To me, number 6 says sustain it. Instead, can we do both?
but it also, yeah, I think, it in its current version, it says create new and sustain ongoing, which I think we can just keep.
Good. So in order to sustain, you need to market, promote it,
Right.
keep people engaged in the program.
That again is, I don't know if it's another work plan item that we can do, but I think that's a key element that we need to figure
Yeah.
out how to do that better.
So I think to differentiate this from work plan item 9, maybe is back to the context again. So work plan item 6 focuses on programs that are involved, that the community and senior center are involved with. and the city of Encinitas involved with directly. And for item 9, it's those other community programs and services that are offered outside of city of Encinitas. I mean, outside of the city government. Such as the village, such as CRC, right? Those programs that are not directly engaged with the city. Does that seem okay?
With that clarification, I think we need to wordsmith number 6 to express that, or the same thing with number 9, to separate them so that it's clear. I think it will be significant when it comes to our outcomes.
Yeah.
This is Manager Good. So I do think awareness is really important of all of the senior resources, especially the ones that 211 spoke of. But I also think it's equally important to be promoting and marketing our city programs as well.
Yes, I think we're all
I
on the same
agree. I
page.
agree.
Yes.
And what we're saying is 6 is promoting city programs, and 9 is promoting those other community
Community.
programs.
And that is done at the senior center, just so you know.
Right.
The senior center does provide resource information. So we do provide information on the, CRC, 211. It's something we do on a daily basis.
But as the commission and the ad hoc group learns about new programs or learns more about existing programs, we can pass that information along.
Okay, and this is Measure, I will go back to city management and talk to them about the village movement, so.
And the whole dues thing.
Correct, exactly.
Okay. So outcomes. What are the kind of outcomes that we want for these work plan items for this next fiscal year? I think 1 and 2, and what used to be 3, those can all get rolled in. I don't think those change for this next year. Do we want to basically? By the way, we didn't go over outcomes from between February and March because they all roll into the new fiscal year. But I'm using this time to say something about the Senior Awards Program and the nominations. Manager Goodsell, you want to fill us in? Sorry, putting you on the spot
I'm
here.
sorry, where are we putting this in, or is it just a point of information?
This is just point of
Thank
information.
you.
Okay, so if we go to that work plan item, what number is that?
4.
Number 4? Okay, let's go back to 4. So we received 17 nominations. 12 were unduplicated nominations, so meaning 5 of the 17 were for one gentleman and 2 were for one woman. So 17 total.
So kudos to the team for, this is, I think, the result of the promotion and marketing that you guys have been doing. So the job well done. Okay, back to, sorry, I had to mention that because I'm looking at outcomes.
And that will be put on the agenda in April. So that's when the recommendation from the ad hoc committee will go to the full commission for vote.
Okay. Do we want to change anything in the outcomes for the partnership with the Rotary Club for senior awards? Is that okay the way it is?
I think it looks fine. The ad hoc committee has updated and made, made changes to really look at best practices. So I don't know that the work plan needs to mention the changes that the ad hoc committee has made, unless Manager Goodsell, unless you're identifying anything specific.
No.
I think it looks good to me, and, it's.
Okay, so
Wait a
note
minute.
I think it's
Thanks.
fine.
Point of information, changes to what?
to the outcomes.
No, you'd mentioned changes to the,
I said that there is the changes that the ad hoc committee might make is,
might
Aside-
make, I'm sorry.
right, not on the work plan. That's behind the scenes, like
Thank you.
any ad hoc.
Thank you.
Okay. All right, so we're going to leave work plan item 4 alone. Work plan item 5 is intergenerational programming. And I think the description on the left can stay the same. On the right, the outcomes are, I think, continuing to collaborate with the Youth Commission on various events. And as Commissioner Hanwood mentioned, we also want to pursue intergenerational garden with the Boys and Girls Club. Hopefully that'll pan out. So those are two things that we're looking at for possible outcomes for this next fiscal year. Any other ideas, any suggestions? Okay, so let's move on to work plan item 6. I think we got the gist of the description, and Manager Goodsell will wordsmith something for us to review before the next meeting. And this is in the context of things, City of Encinitas and community and senior center programs. Do we want to, is there our particular outcomes that we're looking for, or is it strictly doing a better job of promotion and awareness? One of the things I think that made a big difference with the senior awards was having the big sign at the entrance to the lobby of this community center, having flyers everywhere. I think working with various community organizations.
Press releases,
Yep.
sure.
This is Manager Goodsell. Maybe for next year, we add a question, how did you hear about this program?
Yeah, so we've done that in the past, by the way, for techie tutors. And invariably, the majority say they get it from the newspaper.
That again is what I think exactly what we're talking about, expanding our visibility with not only the staff to the extent that we can, but actually putting it out there so that everybody, I was at an event, Women of Impact, and met a young man, his name is Mark Christensen, who apparently received a Rising Star Award from the Chamber. And he's very involved in intergenerational. He goes to La Costa Canyon. So again, I think for me, that's our big thing right now is how do we get the information out so that people know?
Yeah. And one other example is when we line up speakers for the commission meetings. If we can line them up months in advance as opposed to a few weeks before, these are things potentially we could put in a big sign in front of the community center, or even list them in the guide, the quarterly guide. So the idea is the more eyes are laid on these kind of things, the more opportunity there is to attend.
And this, Manager Goodsell, goes back to what we've talked about is getting a spinner with our flyers. And my other idea is to have that spinner move. So we spoke about this AARP. There was a whole bunch of people, and most of them, maybe all of them, were seniors. Having that spinner move to where the seniors are congregated, be it AARP, be it whatever else, and even the senior dances, so that no matter where you go, you look at it where seniors are going to be.
And keeping that carousel of information fully stocked and up to date.
Absolutely.
This is Manager Goodsell. You'll be happy to know that we do have a brand-new flyer rack that is portable. So pop on up to the senior center and check it out.
Okay, it belongs to the senior center?
It belongs to the community and senior center, so
Okay.
we now have a total of 3 racks.
Okay, so.
That can be moved
Commissioner
around.
Copeland, we also spoke about putting some pictures up when you go down the hall. I see the banner that was hung. The banner is lovely. I have a question about that, but it's something later. But we spoke possibly about when you turn down the hall, the beautiful banners here. There's a spot, it happens to be above the trash can, but putting some pictures of seniors so that as soon as you look at it and then you turn and you have a visual of something going on.
And that's something we can discuss
Right.
once the work plan's finalized, when we're working on a specific agenda item, but it's not on the agenda for today.
Okay, sorry.
That might fall under the work plan item 6 that we're talking about now. So, okay. Anything else we want to do for create new and sustain ongoing programs? We have enough to go on here? Okay.
This is, just one second, this is Commissioner Martin. That last line on outcome, conduct program evaluations as needed for feedback and input. I know we did that with the generational, the IT events and several. Is that a standard practice?
No.
I like it, and I like that it's in there. Feedback and input, doesn't really say that we're doing anything with it. I think that it's a great idea. I've always used evaluations for all my training events. So anyway, I just thought we should look at that for.
So you're saying written and/or verbal, in a way to get the empirical data?
Well, we could say and make changes as needed.
Right,
Yeah.
exactly. That's where
You don't have to.
yeah.
Right. For example, we know from our experience with Techie Tutors that we really need to pay more attention to press releases because that's how most people hear about it. We know from the Health and Wellness Expo that from Commissioner Koblenz's comments about some of the questions that were answered for the raffle. We know where a lot of those attendees were coming from. So we can basically adapt what promotion efforts work, what outreach efforts work, and then shift our focus and our attention to those things based on that kind of feedback.
Exactly.
Okay. All right.
I think there's a comment or a comment box somewhere, or is that just in where
It's-
people?
It's whatever we want to make of it. So if there's a piece of paper, we can put a box
Yeah.
in
This
there.
is Manager Goodsell. There is a comment, suggestion, and grievance box at the senior center and the lunch program.
That's where I've seen
And then
it.
we
Yeah.
also have done SurveyMonkey surveys for individual programs and paper surveys as well to get feedback.
Okay. So let's move on to work plan item 7. Leverage Age Well San Diego. We're going to add the age-friendly communities or age-friendly cities to that. Is there something in particular we want on outcomes on the right side?
What about monitoring and, looking at feedback, somehow obtaining feedback and just monitoring, like we've done with some of these other work plan items? I'm wondering if there's a mechanism or wording we can use to allow us to receive the feedback and then look at best practices and how we.
So some of that is going to be coming from those organizations themselves, right? They're going to say, this is what we should do to enrich the experiences of seniors and in some cases youth in our cities. So I'm not sure where. So a lot of that information is going to come from Age Well and age-friendly cities from AARP. What I'm wondering is, what specifically do we want this commission to do to accomplish as outcomes for this particular work plan item?
So when it says, translate the information gained from the interactions into actionable change which enhance the lives of citizens. Translate to me is an incredibly subjective word.
It is, and it covers a multitude of sins. Part of it is there is so much information that comes from these organizations that you try to distill that down to something that is digestible by this commission and potentially by its audience is hard to do sometimes. It's like a fire hose. If you go onto the sites, there is so much. And so I think the translation is basically our attempts to, how do we distill that down to something that is digestible and manageable?
So what if you use translate the information? Translate to me is facts and figures. I mean, distill. Translate is real subjective.
We can find a different word for that. So that and I'm okay with that. It can be distill. It can be identify actionable items or key issues to focus on. Again, this is, what things can this commission do with all that fire hose of information from AgeWell and from AARP? We've talked a little bit about actionable items. I'm not sure I think one thing that came out of this in the context of AARP was the letter, write a letter of encouragement. But are there other things that we can do?
Yeah, of course, we don't know what's
Okay.
That's why I like the words "as needed." You know, we're looking at programs where it's ever evolving.
Yeah,
And I think that the kind of information that we could get from AgeWell
your mic.
and, this is Commissioner Hanwitt. I think the kind of information that we can get from attending the AgeWell meetings and hopefully the AARP age-friendly city meetings, we can use with our other work plan items. It can, it can impact how we look at how we're doing some of the other things that we're doing.
Okay, and I think that's actually that's a good outcome. So we basically say, from what we learn about AgeWell 2.0 and age-friendly cities from AARP, we can take that information and help direct activities in the other ad hoc groups, the other work plan items. Is that fair?
This is Commissioner Angel. My personal comment. Before we start rewording and wordsmithing, I personally do not care for the word distill, so I'm wondering if we're going to change words and take out, translate, maybe we need to look at something
Yeah.
that's palatable to all of us.
Yeah, and I think basically what I said was I've avoided that whole translate distill thing, and basically said whatever we learn, what we learn from AgeWell and what we learn from age-friendly cities, we look at this and figure out what we can apply to our other work plan items. That's kind of where I'm going with this. Is that an acceptable outcome?
I
I
like
think so.
that. I think
Yeah.
so. I like that.
Okay. All right. That brings us to work plan item 8. I don't think we need to make any changes to outcomes for this one, grant funding. Are we okay where it is?
Yes.
Okay. Item 9, we've talked about this being in the context of promoting programs and services outside of venue of City of Encinitas. So again, we're talking about things like the Village CRC, other programs that seniors would benefit from. And any particular outcomes that we're looking for that that'll help us add context to this?
Not yet.
Okay. So we'll fill it in, I think, as it goes. Okay. And work plan item 10, I think that stays the same as well, unless anyone has some improvements for this. This is for best practices and letters of support.
The one suggestion that came up was the follow-up
Right.
to be a little bit clearer.
Yes. So if we put follow-up into the left side
Yeah.
and keep everything on the outcome side where it is, but specifically mention follow-up in the description. Okay? Thank you. Okay, so I think we have a work plan. Who wants to be in the various ad hoc groups? I'm
Start up with.
So obviously, all of us are in one and two. Do we have any commissioners who are interested in continuing with work plan item 4, which is Rotary Club?
This is Commissioner Angel, and I would definitely like to remain on work plan item number 4.
Okay. let's see how's the best way to do this? Commissioner Angel, what other ad hocs would you be interested in?
This is Commissioner Angel. I would like to be added to work plan item number 5, working with the intergenerational programming. I would also like to remain on work plan item number 7.
Sorry.
Okay.
Commissioner Koblenz, I'd like to work on work plan item number 6 and work plan item number 9. I think that's it for now.
Okay.
Commissioner Martin, do we not have a problem since the numbers are not?
They didn't move around that much, so
Well,
we
we
know
took-
that 9 is different, but
But 4 is not 4, it's 3, is it not?
3.
that's okay. But
For right now, I
for right now,
Right now.
Okay.
Keep it the way it is.
And this is Commissioner Martin. I would also like to stay on the 4 as far as the senior service awards, and didn't bring a copy, so
Yeah, maybe we can, right.
if you don't remember the numbers, you can just call it out by the description.
Commissioner Martin, 6, I think, and I guess
You turned yourself off?
Commissioner Martin, this is Commissioner Angel. I recall a conversation, I thought you were curious about work plan item number 5, the intergenerational and the techie tutor and all of that.
You're right. Yes, and I would like to get back onto the intergenerational work, brilliant work that
Okay.
our leader is involved in.
Okay, well, I am interested in number 7 and the grant writing. Maybe we could,
Scroll up.
scroll up the, no, not
The other way.
scroll the other way. Okay, so it's 8 and 10. And then now I can't remember how we decided the one,
So 1 and 2, we're all in.
well, yeah, not 1, 2, 3, or 4. We're worried
Yeah.
about that. But
Okay.
down, the one that we just discussed that would include
That was
the
9.
community. it's
That was 9.
Okay.
Okay, and keep in mind, these ad hocs are not going to be fully staffed because we're short a couple of commissioners right now.
Commissioner Koblenz, I'd like to join item, grant writing number 8. I'd like to learn from the master over there. That's you.
Okay. Oh, I guess it's my turn. I would like to be involved in intergenerational and grant writing and best practices. So that was 5, 8, and 10. And that gives us plenty of room for new commissioners to drop in.
This is Commissioner Martin. Speaking of new commissioners, is there any?
I'll discuss that in the operations report.
Did we cover all we needed to do for the proposal for the new work plan?
Looks like we did. Great job.
Okay, so this is probably a little anticlimactic, but agenda item 8C is the calendar for our meetings for 2024-25. Starts with this one, March 19th. It's monthly on the third Tuesday of the month at 2 p.m. Month of July, we're dark, and month of December, we're dark. Do Do we have a motion to approve our meeting calendar?
This is Commissioner Martin. I move to approve our meeting calendar as posted.
Okay. Do I have a second?
This is Commissioner Hanwood. I second the motion.
Okay. Commissioner Martin has made the motion to approve. Commissioner Hanwood has made the motion to second, and we get to vote again.
Let the record show that the motion to approve the Senior Citizen Commission proposed meeting dates passes unanimously with all commissioners voting yes.
All right, that brings us to agenda item 9, informational items. Manager Goodsell, you have a senior center operations report for us?
I sure do. All right. 507 meals were provided at the senior lunch program in February, and 204 one-way rides were given. There were a total of 966 non-nutrition participants registered for programs in February. Mark your calendars for the upcoming senior events, including a birthday celebration on April 5th, bingo on April 16th, Spring is in the Air theme luncheon on April 19th, and the Spring Fling social dance on April 19th as well. At the Community and Senior Center, new LED lighting is being installed in the gym and new LVT flooring in the banquet hall the week of March 25th. The banquet hall AV has been upgraded with 6 new wireless mics, and a new LED projector will be installed this week. The contractors returned to the center this past week for some troubleshooting and identified and corrected the challenges with the speakers. And regarding the senior commission applications, we did receive one application by the extended deadline of March 14th. City Council will tentatively be making an appointment on March 27th, and the city will continue to advertise to recruit for the remaining senior citizen commission vacancy. And that concludes my report.
Thank you. Supervisor White, you have event updates for us?
I sure do. Thank you. Does it work? Is it on? Okay. I sure do. Okay. I have a long list of events for you. First of all, for the department in general, our new spring guide went out March 4th. And registration is up over last year's registration at this time. Could partly be due to 20 new classes that have been offered this year over last year. So we are growing. Art Night was on Saturday, March 9th. The event had over 1,500 people in attendance throughout the venues. And attendees were able to benefit from the free shuttle between locations, and they could speak with exhibited artists in person, enjoy live music. There were film screenings. They could purchase artwork, and there was also some art demonstrations and classes available to attendees. So it was a great success. The State of the City is this Thursday. I know some of you might be joining me there as an attendee or a volunteer, so thank you. And that will be held at the Community Center. The Encinitas Spring Egg Hunt is Saturday, March 30th out at Encinitas Community Park. Again, if you have not already volunteered and want to come join us for this great family event, you can. We will have 3 egg hunt times at 10:15, 11, and 11:45, and we separate the ages on the field so that the youngers have their own space to run and collect their eggs. There will be a live performance concert by Hullabaloo, a beloved children's music group there. There will be a bubble man. There will be arts and crafts. So it should be fun for everyone. And we're encouraging everyone to park at San Dieguito Academy High School and use the shuttle over to the park as parking is limited. So. We also are in the process of planning and getting out our invitations for our VIP volunteer appreciation reception. You should be seeing that come to your inbox within the next day with printed invitations coming shortly. It's going to be held on April 29th from 4:30 to 6 out at the Community and Senior Center. And we're going to have a spring theme where we're saying Seeds of Service, growing our community with our volunteers. So put that on your calendar and keep an eye open for that invitation. And then another couple save the dates for events. Arbor Day is taking place on April 13th from 9 to 12 at Encinitas Community Park, and their goal is to plant 50 trees. And we have a Movies in the Park that is scheduled for Saturday, May 4th at Glen Park, and we are going to be showing Elemental, and that will show on the big screen in the park outside under the stars starting at dusk. And that is the lengthy list of events.
That's a lot. Thank you. Agenda item 10, commission member initiated agenda items. Do we have any commission member initiated agenda items?
There are none.
Okay. Agenda item 11, future agenda items added by commission members. Do we have any agenda items, commissioners, to be added for next time? No? Agenda item 12, commissioner reports. So this is our usual end of the meeting roundtable. I'd like to ask the commissioners if you have any announcements or other reports that you'd like to add. And I'll start from the far end of the dais with Commissioner Martin, and we'll just move this way.
It's always me. Nicole, I just wanted to add for the feedback on the art night. I had done that before, this is Commissioner Martin, and when I was in the community center, my first reaction was there didn't seem to be a lot of people. But as I continued to watch that and move back and look at other rooms, it really expanded, and it also seemed so different from the one from last year that I had gone to. And I really, really liked the format. And I could tell just by watching people and asking for feedback how much the audience and attendees loved it. They loved participating, they loved the drawing, it was, I loved the format, and I thought it was very well received by everyone. The only thing that I would suggest, just from my standpoint, we did have the little maps on the table, but it would be nice if it was blown up and put really out there in front with a big bold thing of, we have vans that bring you around and such, because there was quite a few people that walked in and kind of like, who is everyone and where am I supposed to go? So maybe a couple of larger maps to show the format of having all those workshops and participations and dance and such. It was pretty awesome. Good job.
Great, that's great feedback, and I'll definitely pass that on to the program staff. I know they've been working hard to really reinvent that event and draw more people, so I will pass that along, maps included. Thank you.
Commissioner Koblenz, I would like to remind people tomorrow at Maricosa from 6 until 7, Senator Blake Spirit is hosting a fentanyl workshop, a topic that is very apparently of great interest right now. And then, of course, as we know, the state of the city. I went out and think, I'd like Coastal Roots Farms to come speak, if at all possible. And just another quick little thing. I had the privilege of being at the ribbon cutting for the Buena Vista Navigation Center, which is where the city is partnering with Vista for those unhoused. And it's a wonderful opportunity to see two cities work together and to try to even more collaborative work on the unhoused population. There is a lot of information. It's definitely a worthwhile thing that I think people might want to know about. And if you happen to know someone who is unhoused, there is a form to fill out. It's a warm lead, and then it goes to our city housing person. So just something that was really, really nice to see. And then on another note, Encinitas Chamber hosted a ribbon cutting for a group called Stella, and the mayor was at both of these. Fascinating about I wish I really knew what it was, but it's primarily treatment for PTS, depression and such, and they do intravenous and they do magnetics. Beautiful, beautiful thing over here on Garden View. Incredible medical advancement, and to see one of these in our little city, our big city, I'm sorry, according to me, is now 60,000 people, 60,072. So just an FYI, if you even remotely interested in how we are growing, not only locally, but nationally, check it out. It's called Stella. So that's all I have.
This is Commissioner Angel. A couple of things. I've had the opportunity to meet with several of the deputies here in the North Coastal, and while I attended that event, I did make a point to speak with seniors about their concerns, specifically related to some crime and their perception, which the deputies were very prompt to discuss, and the trending downward of crime within the city of Encinitas. So I was happy to engage with that activity. I will be volunteering for State of the City this week, and also I've been selected to attend the Encinitas Academy, so I'm very happy about that.
This is Commissioner Hanwitt. On March 7th, I attended the Age Well Housing Team meeting, and the presenter was the executive director of the Village Movement California, and I was asked to give a short presentation about Village Encinitas, and there were two other villages that were represented, City Heights and Sarah something. I'm not, probably yes. So it was nice to be able to share that information with the people that attend the Age Well Housing Committee, because they represent a lot of nonprofits that work on housing issues. And then on March 14th, I got to attend the Age Well, the AARP Age Well Livable Cities Roundtable, where they invite all of the communities in the county that have been approved and are actually in the process of working on their work plan for being a livable city, and they all talked about their progress and what they were working on, and it was very cool to be a part of that.
I don't have anything to add to this, but I wanted to make a couple of comments. One is, I think there are a lot of events that the commissioners attend that from now and then other commissioners would be interested in attending. So if it's possible to, when you hear about these kind of things, to give us a heads up. I think you can send an email to Manager Goodsell. She can post to the rest of us so that there's something that we'd like to participate in as well. The other thing I wanted to mention was, in order to front load our speaker schedule between now and the next meeting, if you have some ideas for speakers that you would like to participate in our commission meetings, figure out who they are, and again, pass that along to Manager Goodsell. Okay, I think we are done. So I would like to say the March 19th, 2024 Senior Citizen Commission meeting is hereby adjourned at 3:43 p.m. Thank you, everybody.